Hey everyone, welcome to another episode of Psychology of the Grind. I am your host, Rob Walker. We help aspiring leader entrepreneurs develop their mindset and business skills to win in business and in life. And today's guest is a powerhouse in every sense of the word. We have Dr. Calynn Lawrence, and she isn't just another voice in the mental health space, she actually lived it. Diagnosed with MDD as a teenager, she turned her personal battle into a mission that is now global. She's a multi-board certified trauma expert, neuropsychotherapist, humanitarian, former pageant queen, and founder of Holistic Healing Source. Her work focuses on helping marginalized communities find real evidence-based holistic solutions to trauma and depression. In this conversation, we're going to cut through the noise around depression and get straight into what works, what doesn't, and how leadership, psychology, and a lived experience collide in the healing process. So if you've ever battled with depression or love someone who has, you're going to want to lean in for this one. Welcome to the pod, Dr. Calynn Lawrence. How are you?
Thank you so much for having me. I'm doing great. Excited to be here.
Hey, before we dive in, I just want to take a moment to say, if you find value in these conversations, if they challenge your thinking or help you grow, make sure you subscribe or follow the podcast. It's a small action that makes a big impact, and it helps us continue bringing meaningful conversations to people just like you. Now, let's get into it. So glad to have you. I've been looking forward to our conversation for a while now. I know we scheduled this a little while back, and it's so timely. I can't even begin to tell you how perfect the timing of this all is. And when I say, at the very end where I say, if you've lived it or you know someone who currently lives it, where do I even begin? You know what I mean? So I have a brother who currently hasn't been formally diagnosed, but we know that this is exactly what it is. So I am loaded with questions. Cannot wait to pick your brain.
Well, I'm excited to talk about it.
So I'll start off just by kind of letting you have the floor. If you want to share a little bit about your history, I'll let you go ahead and do that. That way you can introduce yourself the way you would like to be addressed.
Well, professionally, I think you did a great job. I guess a little bit more detail about me personally. I am 29. I am an African American woman from the south side of Chicago, born and raised, now living in the suburbs. I got diagnosed, as you mentioned, with major depressive disorder at 14, and that started a long journey of me figuring out my own mental health, which then led me to that, plus a lot of people close to me, friends and family that I saw go through their journeys. That led to me eventually going back to school and doing what I do now. So I'm excited to get into it.
For sure. So I guess just to get right in, at 14, diagnosed with MDD, I'm sure you had other goals, aspirations, things that you wanted to do. How did that sort of become like the driving force into the field of work that you're currently in?
I think for me, being so young with a suicide attempt, so I actually had a suicide attempt on my 14th birthday, unfortunately, and I had been ruminating and stewing on an assault that I experienced, and then some other factors were at play to where I felt like I was not in a position to be able to share these things with my loved ones, and that eventually led to that suicide attempt, which I was hospitalized and got on meds, and they diagnosed me at that time as being clinically depressed, and it was the beginning of my journey with mental health, at least. And having experienced being a little bit of like an oddball, because it's not that common, or at least it wasn't back then, especially among people of color, to be diagnosed with something like that and have been hospitalized so young. So I think for me, like, having been in therapy since a young age, having been on and off several antidepressants and medications like that, having experienced a wide variety of mental health treatments and things like that from such a young age, by the time I was an adult, I had the opportunity to become a pediatric behavioral therapist, which I did during COVID for like maybe 7 months or so. I think that was the job that, because I had worked in marketing and media like prior to that, like all of my
Yes.
jobs were marketing and media, but then working in that job specifically, it made me say, you know what? I think I want to pursue this further. So that's how I ended up going back to school and pursuing more advanced degrees, because I already had a degree, but that was in like business and humanities. So I said, I'm going to go back to school and study social science and counseling and all this other stuff. And that then led me to get to the point where I launched the Holistic Healing Source, and then, all of the resources that come with that.
Absolutely. I think that's so fascinating because, as I was doing my research, I saw that you're into fashion and design and things of that nature, and like the whole like pageantry. And so tell me a little bit more about that. Was that like your first love, or still is a passion of yours, or how does that sort of play into who you are?
Yes. So thank you for realizing that about me. Yes, I definitely am still very ingrained in like the arts and entertainment space, fashion space. My first job was when I was 15. I was a retail business intern at the downtown Chicago Nordstrom Mall. And I did that for most of high school. And we dabbled in design, fashion show production, sales, marketing, customer service. We did it all. And that plus, I had a blog, a fashion and beauty blog in high school. So, like, those two things really laid the groundwork for me to develop a lot of connections, like throughout my career in the space, and working with over 1,000 creatives and talents and people of all different disciplines through the Fresh Faces Project, which is my nonprofit initiative where we offer discounted or free Marcom services for people. And then even like hosting live cable television for a couple of years and interviewing people that way and doing a lot of red carpet work. So all of those things came together for me to then pursue pageantry when I was in my mid 20s, which for pageantry is very late in the game. So like shout out to Lasagna and the Galliano family who, really encouraged me, because at first I'm like, there's no way. Like I'm not getting into that. And I did. And like my two highest titles were when I was Miss World America Nation 2020 and then Miss US Universe Tourism 2021. And I really enjoyed those things, but like pageantry is a lot of work. It's very time consuming, a lot of appearances, a lot of community service. So when I was like in school, I was in school and doing pageantry and working full time and having other ventures for a bit. But after I finished my reign in 2021, I was like, I gotta retire.
Yes, yes. No, that's very fascinating. I find all of that. I just find the way people's journeys come together very fascinating. I just find it so interesting how our passions end up guiding us to our ultimate purpose. And so I love that. With that being said, you enter into the space of holistic healing. How did you come to holistic ways? I guess let me phrase that better. How did you get to the holistic side of wanting to find out about treatments in that sense versus regular medicine?
So that's a really good question. So for me, having experienced so many different therapists and therapy modalities and medications and things like that since a young age, and then also having worked in a pediatrics clinic doing behavioral therapy, which is, you know, strictly, that's pretty much strictly scientific. I wouldn't call it holistic in nature. Like having experienced those things, both being the practitioner and the patient over all those years, I said, you know what? This is good. This is a good start. But I think that, it takes more than just this to really, especially when you talk about people who are intersectionally marginalized, right? Like people who
Yes.
are, minorities, have disabilities, and or women and or queer. Like once you start layering all that stuff, like it takes much more of a well-rounded approach. So that's when I
Yes.
started looking into therapeutic modalities that really looked at the whole person down to like not just the emotional and the physical, but also the spiritual. Because that
Yes.
spiritual piece, like I feel like it's very underrated in a lot of
Yeah.
communities. People really don't think that it has the effect it does on your overall well-being, but having adequate spiritual care for whatever faith you belong to,
Mm-hmm.
whether that's no faith at all, or whether you belong to a church and you're committed, whether that's Christian, Islam, Buddhism, Hindu, like whatever it is, it's
Yeah.
really critical to our overall well-being. So that's why I chose the path I did.
Yes, I love that. I think that, to your point, when you look at the symptoms, or if you want, for lack of a better way to put it, of what kind of encompasses clinical depression, one of the things that it references is hopelessness. And what gives us more hope than our spiritual side and having that foundation of something more to believe in? So I can definitely see the connection between the two. When you feel like all hope is lost and you don't know where to turn, that's typically where we go, is to our faith. You know what I mean? So
Yes.
that makes perfect sense.
For me, there are, I just want to add a quick comment. There are a lot of people who assume that just because you're a pastoral counselor or a faith-based therapist that you only work with Christians. Myself, I identify as what's called a Christian universalist. So while I am a very like modern, non-judgmental, like flexible Christian, like I believe that like anybody of any faith background can find salvation and reconciliation with like God and the universe. Like I don't think you have to specifically be Christian. I feel like you just have to be a good person, to
Yes.
get those blessings and things like that. So, for me, like that was really important too. So like even with my like religious trauma certification through the Global Center for Religious Research, that was more Christian based, but still non denominational. When it came
Mm.
to like my doctoral research project coming out of seminary, I made sure to highlight like a variety of different religions outside of just Christianity when I talked about the importance of holistic prison programming to reduce recidivism among the incarcerated with that faith based piece. So, like, I
Yes.
just wanted to add that there.
No, I love that. I love that. I think that's huge. And I definitely want to talk about that more because, um, well, selfishly, I know some people who could definitely benefit from that. When it comes to someone, let's say, coming to you and they understand what exactly it is that you do they ever challenge the holistic side of things when they're expecting more like science based information? Hopefully that makes sense.
No, I totally get you. I like to see both sides of things. Like, I like to see, okay, what is the hardcore, like, modern modalities, Western medicine that tends to be the most
Mm.
advanced among, like, other types of medicine? What do we have there from the psychological and psychiatric perspective that can really help heal people? But then also, what do we have that is not so easily measured in terms of like the faith based, the spirituality, but has still been proven in many social scientific studies to have positive effects, even if you can't directly explain them, but like people can still see them and measure them and that positive progress, even if they can't exactly explain like how did this happen, because it's more theoretical, because
Yes, yes,
nobody
yes.
can.
Great way to put it.
Yeah, like nobody, well, I don't want to say nobody. Most people accept that they are not having like a direct conversation with God or their higher power in like the same way you can sit down with your psychiatrist. So I think
Sure.
for me, a lot of people, because they can't have that direct conversation with the person's higher power the way they can with their psychiatrist or psychologist, that in itself is enough for them to be like, if you can't explain it, I'm not interested
Yeah.
in it. But for
Yeah.
me, it's less about being able to explain exactly what happens internally when you're engaging in adequate spiritual care and things like that boost the mental health. It's less about being able to explain that down to an exact science and more about
Sure.
the positive outcome. So I always push that with people. I'm like, whether we can get to a metaphysical level and like see exactly
Yeah.
what's happening within the person's spirit, that doesn't matter to me. What matters to me is the good outcomes.
Yes, I like that. I think that's obviously the most important thing anyway, is the outcome, no matter how you
Yes,
arrive there. So,
yes, exactly.
I guess to that point, so your work, it bridges faith, it bridges mental health, it bridges activism, all of this within like our marginalized communities. What's sort of like your guiding light when as you have come to put this all together?
my big appeal is making things trauma informed. And that
Yes.
is why I pursued my religious trauma certification, my clinical trauma specialist certification, my registry with the American Academy of Experts in Traumatic Stress and acute traumatic stress management. So, like everything for me, when you're dealing with marginalized populations, that trauma at
Yes.
the bottom, just the systemic oppression alone, automatically is inherent generational trauma, let alone the
Yes.
things you individually experience in your life. So, for me, like when I try to teach, my free lessons, and then even with the free library, like all of the self help books we came out with that people can freely, easily download, no contact, no payment
Yes.
info necessary. We put trauma and trauma principles at the foundation of everything, like how to identify trauma, how to heal the trauma, how to
Yes.
utilize resources around you to mitigate those things and prevent those things, both in your individual life and then from an advocacy standpoint, like how the government can systemically prevent these things. So I'd say that's
Yes.
the main guiding principle for me.
So as you put this together, and I know that you've had impact doing this already. What have your findings, I guess, led you to as far as those that are sort of like incarcerated? I would think that like empathize with these people so strongly that you want to help them in any way possible. But at the same time, it's like all you can do is give them the resources, but they actually have to do the work.
Yes. So, one thing for me that I have come to realize is that people, and I feel like I probably knew this before, but it didn't click as well. People, especially when you're talking about minorities, and unfortunately, especially when you're talking about men, because men receive less mental health services by a large margin than women do, due to like the way society pressures them to be strong. I feel
Yeah.
like you can have the resources there. That doesn't
Yes.
mean people will use them. And that
Yes.
can be very disheartening. Like you can do all of the promoting, you can do all of the sharing in the groups and emailing folks and posting and boosting ads and all of that. That doesn't mean people are going to use them. And that's something that I have had to just accept, because I recognize that it's a layered mentality why people may be scared to indulge in those kinds of programs. And then in terms of like the systemic level, like the advocacy piece, one thing I have noticed is that it's really difficult to get a lot of buy-in from people who, like I say, they because they don't fully understand it. They're like,
Mm.
I don't know. Even if you can show them, look at all of these studies. Like my doctoral research project had like 40 something cited in my literature review, like 40 something cited peer-reviewed scientific studies and breakdowns of all of them. And like even that, because like, oh, it's spiritual care, people are still like, I don't know. And then just also when you talk about anything religion or faith based, people already are kind of like a little iffy anyway. So for me, I have just had to accept that the people who want to engage will engage, and the people who are not ready, they're just not ready, and not to take that personally. But
Love
whatever
that.
happens,
Love that.
I'm just going to continue to promote it, and they're going to continue to see it, and hopefully one day they'll be ready.
Yeah, and I think that's kind of how you have to lay it out there. If somebody wanted to get tested for clinical depression, what would you recommend? Like, what's the best way to go about it?
I definitely would say to go ahead and call it. Well, this is assuming you have insurance, whether that's Medicaid or, private insurance. I would say call them or go to the website, see what providers are in your area. And then even if you can
Mhm.
do like a sub search by like the type of condition you have, I know some insurances allow you to do that, like psychiatrists near me, psychologists near me, and then specialty, they'll let you insert the same way they do with like a primary care doctor or something like that. So I would say go ahead and do that and get that started as soon as possible, because honestly, like once you get diagnosed, it makes things so much easier. You can, if you want to get
Yeah.
medicine, you can get medicine. If you want to pursue certain types of therapies and have your insurance cover it, you can do that. If you want to just know for the sake of knowing, like that helps
Right.
as well, so that you can find that
Yeah.
community with like knowing there are other people like you. So that's what I would say.
Is there any way to do like a self test? Or is there a way to sort of say, okay, maybe I might need to seek treatment based off of these symptoms or characteristics?
Yes. So you can also do some of those, like you say, those self tests. They have plenty of them online. A lot of like nonprofits that are focused on mental health, like will offer some kind of screening or quiz that you can do. If you want
Screenings,
to
yeah.
start there, definitely, definitely start there if you want to do that before you jump into making an appointment. But I do want to note that people should be just a little bit cautious sometimes when it comes to the self assessments, just because they tend to be very like niche. So like for example, if I'm experiencing certain symptoms that could be caused by clinical depression, clinical anxiety, and or childhood trauma, if I take a
Yes.
quiz about depression, I might not, pass the quiz for depression, but it could still be something else. So like I would say take those with a grain of salt, but you can start there.
I love that. I think that's huge. I know just within my own family, we're learning more and more about, our past and people who have struggled with certain things before. It just wasn't open information. And so now that we're starting to find out more of this information, it's like, okay, what do I do with all of this information now? Or how do I make good on it? Or how do I better myself from here? So I think that just getting the information has been eye opening. And to your point, I've been seeing a lot of stuff online about screenings and whatnot. And so just whether it was something that was free or something that you had to pay for, just kind of wanted to get a better understanding of what is it we should be looking for so that we're educated properly, because there's a lot of information out there on the website and you can totally misdiagnose yourself just by checking some boxes that you see on a screen. You know what I mean? I guess so. Looking ahead, in the space that you're currently in, you're sort of one of very few who are actually doing what you're doing, if not the only. How do you sort of see things progressing over the next few years?
Honestly, thank you so much for that observation. Honestly, I would love to, within the next 5 years, have a regular schedule of speaking engagements. I'm an educator at heart. Like, I love
Mm-hmm.
teaching people, and I have the mentality of you can, bring a man a fish and he can eat for a day, or you can teach a man to fish and he can eat for his lifetime. I want to get to the point of, outside of just my online content where I do a lot of teaching and giving resources, doing that on the ground at conferences, at schools, at,
Yeah.
businesses, like how community centers. And I do some of that now, but I'd like to really ramp that up and scale that up, because I also feel like that in-person connection a lot of the time makes a big difference between someone getting help and someone not getting help. And then also I wanted to add that I did not mention this in the last answer I gave, but if you don't have insurance, go to nami.org, nami.org,
Okay.
nami.org for the National Alliance on Mental Illness. They have local affiliate chapters all across the US, and they have a lot of free services for people who are struggling with
Oh,
their mental health, whether they're formally diagnosed or not.
love that. I'll definitely check that out. As far as your regimen for your personal self care, how has that evolved over the years since since being formally diagnosed at age 14?
For me, I have a very eclectic like self-care regimen, so I think that most people should. It should contain a variety of some kind of therapy for people who have, mental health conditions, some kind of therapy, some kind of creative outlet, and then some kind of health relate like physical health related practice. So for me, when it comes to therapy, I do both one-on-one therapy and I go to support group therapy. In terms of like hobbies, I love to travel. I love like anything artsy and creative, live entertainment. I regularly get out of the house. So since I live alone, I get out of the
Yeah.
house so I don't sit and ruminate in my thoughts. So having
Yes.
that to keep me busy, community service, all of that. And then that physical health piece for me, I drink a lot of like herbal teas and water, and I like to go on walks and stuff like that. So having a
Yeah.
well-rounded self-care routine is important for me.
I love that. I love that. I think that that's huge. Marginalized folks often face systemic neglect in mental health. Can you share a strategy that you found that actually works in breaking through these barriers?
Yes. So that's a good bridge even with NAMI. I think that having more funding for those grassroots nonprofit organizations that cater to people with mental health conditions and can offer those services free of charge, that is at the baseline, the main strategy that the government really should take to help treat and minimize the impact of mental health conditions. So when it comes to marginalized communities, we often are also low income, or even if we're not low income, due to the stigma that exists within minority communities, especially among men, unfortunately, like even if you have the money, you're really skeptical of spending your money like
Yes.
on something related to mental health because of like the reputation that it has within communities of color. So my mindset is if it's free and it's available through multiple methods. So like with NAMI, they do over the phone, they do virtual, like video chat, and they do in person. If you are able to give more funding to those kind of organizations who have the staff and the bandwidth and the expertise to offer these services and programs, I think that would solve a lot of problems. That's why I'm like the biggest champion for NAMI, 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 because they just
Yes.
offer so much help.
I love that. I want to be a champion for them too as well. Tell me a little bit more about the courses that you've created.
Okay, so the courses I've created, I actually created those for like a twofold purpose. One, to educate people who were just, interested in learning more about these kinds of topics like holistic healing, mental health, pastoral care, faith based therapy. And then also for professionals who already work in relevant fields who wanted to further their education and have some kind of credential that showcases their added expertise in a pretty niche area. And when I
Yes.
created the courses, it took quite a long time. As you see, all of the slides have like a lot of like peer reviewed references and a lot of information. And then the courses are also globally accredited, which was a whole nother process because I wanted to have that gold seal to show people like this is quality information. So
Yes.
getting global accreditation for the research through the International Practitioners of Holistic Medicine Board, that was another step. But now that that's all done, the courses themselves are for free, so anyone can access them. But if you want the actual board certification that comes with completing the courses, that's available for a very small fee and for a short exam. So that was my purpose with the courses.
I'm sure that had to be a labor of love for sure because I can only imagine the time commitment that it took to put that together.
Thank you. Yes, it definitely took a lot of time. I'd say I spent at least a couple hundred hours. And then I also, hired out some other people to help do certain parts of the courses as well. And then the process of going through accreditation is also a whole nother thing. So it certainly was a lot to go through. But my hope is that the output of having these things available for free and easily accessible, that will outweigh the cost that I put in.
I'm switching gears just a little bit because these next set of questions are very specific for myself. I was curious about these things. But I'm sure if I was curious about them, that other people are curious about them too. How do you personally tell the difference between I'm having a bad day and I'm entering into like a depressive episode?
That's a really great question. So I would say that the key tells between just having a bad day or even a bad week or something like that versus I am actually clinically depressed and should talk to somebody, or I suspect that I am at least because you wouldn't have the formal diagnosis at that point. I would say look for one, the length of time that you have been feeling these negative feelings. If it's just for a day or maybe even just for a week, maybe you can circumstantially conclude, like, of course I'm having a bad week. I just lost my job. Or of course I'm having a bad week. I just broke up with my long term partner or something like that. I would say, maybe you might be okay to push it off for a little bit. But if you've been, having these very down, or let me not say depressed because you're trying to figure out if you are depressed. If you're having these very hopeless, sad, lack of motivation type of feelings
Yes.
for
Yes.
weeks, especially if there's no easily identifiable cause, I would say at that
Yes.
point perhaps you should talk to someone, because there's going to be good and bad days for every person, but once it gets to the point where this is persistent and you're trying to get outside, talk to your friends, talk to your family, do something fun, get out the house, you're trying to do all of those things and you still are struggling, at that point,
Yeah.
you should really consider talking to someone.
Probably need a plan. Got it. Got it. No, that makes perfect
Yeah.
sense. When it comes to moving from, I now have this MDD or clinical depression, and now I'm trying to get my life back on track. I'm trying to get myself back on, back on feeling normal again. I'm trying to get back to me. I'm trying to get back to who I am. What are some things that someone can do, or some things that you might recommend that they do in order to start to regain that control back over their life?
I would say definitely, one, download some of our self-help ebooks. They're great. They're great tools in your mental health journey. Download those for free. Use those. But outside of that, I would say step one would be to take control of your own healing process. So do your own research, right? And I know that everybody's resources looks different, everybody's financial means looks different, but find the best sorry find the best path for you to get some professional intervention. And I don't care what that looks like. If that's you, like I say, utilizing NAMI and their resources, whether that's you going through your insurance and getting a private therapist, whether that's you, maybe you're not ready to take it to that level yet. Like maybe you are aware of like a pastoral counselor or somebody, that you might have a little bit more trust in. Find someone and start talking to them and start utilizing those
Yes.
services. And then the other thing I would say is sticking to a routine. And I know that not everybody is the type who likes to live by a calendar or a routine. I am. But sticking to a routine and being serious about it when you're trying to pull yourself out of a rut, it's really important. So when it comes
Yes.
to, making sure you're drinking your water, making sure you're getting your exercise, maybe you're journaling, maybe you're, engaging in a hobby, making sure you stick to those things is very important.
I love that. When someone's energy is low and they can't do all the things, what's a bare minimum ritual that you would tell them to prioritize first?
Prioritize the things that will not compromise your overall livelihood. So, for example, if you're very low energy and all you're able to do is make it to work and go home every day, I would say do that. Because then, if you don't make it to work, and some people, become so overwhelmed by their symptoms that they even can't make it to work, which is another case.
Yes.
But if you can, you don't want to then compromise the roof over your head, the gas in your car, the food in your fridge. Like, use the energy strategically to make sure you take care of that. Or maybe you're not, working, but you're in school. If all you have the energy to do is go to school so that you don't have to then drop out and go back and do all of this, put it into school. After you can take care of those like bare necessities, I would say really try and, whatever energy you have left, invest into some kind of care. So whatever modality or whatever type of professional works for you, try to go that route.
Okay.
And some people
No.
that looks different. Some people, they only have the capacity to talk to somebody once every 2 weeks. Other people, they're like, oh yeah, I went to NAMI and I signed up for 3 support groups a week. It really just depends on the person, but talk to somebody. Don't just stay in your own head and ruminate. Like, have an outlet with trained professionals who can help guide you through that and help pull you out of that. Because people love to say, oh, I have friends, I have family. That's not enough. It's not enough.
Yes.
If you're very compromised in your mental health to the point where it's a threat to your livelihood, friends and family are not enough.
I agree 100%.
So that's what I would say.
100%. If someone doesn't have money for some of these things, what are like two or three holistic practices someone can start right away?
So one, I would say, because they're free. Two, I would say utilizing our free library of self-help ebooks. We have anything from activity books to planners to journals to guides to workbooks. Like, we have all of these variety of tools that you can use and download for free. So those would be the
Yes.
first two. And then the third, I would say, is finding an outlet, whether even if that's like a healthy outlet, I should say, because some outlets are not healthy. But even if that's binging YouTube videos, binging podcasts, binging Netflix series, like I
Yeah.
know being a couch potato, quote unquote, gets a bad rap, but if you need
Yeah.
to do that to stay at peace, do it. Don't let
Yes.
people shame
Yeah.
you. Everyone needs a healthy outlet.
And I'm sure you've experienced this when somebody says like therapy and things like that don't work. What's your response to that?
My response is that every type of therapy is not for everybody. Because I've had plenty
Okay.
of therapists that didn't click with me and the way they worked wasn't compatible with my personality type or with my goals. I
Yeah.
believe that there's a therapy out there for everybody and for every condition.
Okay.
And I think that just having the patience to continue to try new therapists. I didn't find a therapist that I felt was truly compatible with me until I was like 22, and I had been in therapy since I was 14. So it's like
Wow. Wow.
most people are not lucky enough. They're not lucky enough to have their first therapist work out great, especially not just on the first or second session. So I would tell people to have a little bit more patience and perseverance. Try out some different modalities, some different therapists. Maybe you're somebody you work better in a support group setting. Maybe you're somebody who needs the one on one. Like,
Yes.
give it a really good try before you just definitively say it doesn't work.
Let's say you've been doing the work, you've been putting in the effort, you're starting to see some results, and then all of a sudden you sort of like fall off. How does one avoid like beating themselves up over it?
For me and for many people I know, that's where that piece of community really comes in. So if you're lucky enough to have friends or family members who also struggle with their mental health, maybe you find community in them. But a lot of people, especially people of color, don't have that. So that's when I would
Mm-hmm.
say, outside of joining those groups like through NAMI or Pathlight or nonprofits like that, you can also sign up for different free Facebook communities. Now, I will say that with caution because some of them are a little unhinged. But I really love those Facebook communities because like when you're struggling and you just need a few people to encourage you and help pull you out of that rut that you're slipping back into, and they have a comparable struggle, and like you don't have to get on camera and talk to nobody, like you can just be in your bed in your pajamas typing on the phone. I really
Yes.
tell people to check out some of those Facebook groups because they have helped
Okay.
me tremendously. Just being able to talk to people online about my struggles and hear that I'm not
Yes.
alone, that helps.
For sure. I want to pivot just for a second because putting this all together, I'm like, okay, I have so much that I want to ask her about. I also want to balance it out with this being a leadership podcast. You are leading in the space that is uncharted. You know what I mean? And so, as a leader in this space, I want to now ask questions regarding how has that been for you, putting your name out there so that people know Dr. Calynn Lawrence in holistic resources and depression all kind of work together. And this is your mission. This is your life's work. This is what you're about.
Well, it has certainly been challenging because well, I don't want to say changing my personal brand, but like add expanding my personal brand
I
beyond,
like that.
okay, she's
Yes.
like this boss chick, girl boss, marketing, media, TV, journalism, PR, like going from that to like, oh yeah, now I'm also talking about holistic health and social justice advocacy in a way that I
Yeah.
have not done before. A lot of people
Mm-hmm.
are like, we usually are just used to following you for like nice content, cute outfits, and funny memes, or like
Yes.
maybe
Yes.
good journalism articles that you might publish. What is this? So I've gotten a lot of people who are not too
Yeah.
interested in that content because it is very different than the stuff I've done before. So I have been trying to diligently get more of my OG followers in support group to like, or not support group,
Yes.
support network to migrate over to like the new stuff I'm doing. But even
Yes.
with that, like, I've gotten a lot of new people who I've connected with who are like, yeah, we probably would have never followed you for that other stuff, but like, we want to connect with you now. So, like, just,
Yes.
staying encouraged and not letting it get you down. And like, because I mean, the engagement is a little bit different. Like, and some of the posts I'll share about holistic healing, they don't get nearly the same engagement as other posts because, like, most of the following I've built up, they don't follow me for that. So, just being
Yes.
positive and persevering. I
No,
try
for
and keep
sure.
going.
I mean, you've put a lot of work into yourself just at the education level. What have been some of the takeaways that you've had?
Yes. So for me, I always think back, and I know this doesn't work for everybody, but for me, it really works. I always think back to how many people did not have, either historically or currently, have or had the opportunities that I have to better myself
Hmm.
and better society through my work. So it's like, yeah, it sucks having to go to full time grad school and work full time and then also have your business part time for years. Yeah, that sucks. But also the fact that I have
Yeah.
the opportunity and the capability to do it at all. And there are so many people who don't. Suck it up and keep going. If you can do it, buckle down and do
Yes.
what you got to do, and just reminding yourself of so many people, especially ones who look like you, who didn't
Yes.
have those chances. It really motivates me to keep going. So for me, like, that grit, that
Yeah.
get up and go, it's really motivated by people I know, either personally or just, like, theoretically, statistically, people I
Yes.
know who did not have that chance and to take advantage of it.
Man, you motivate me. I like it. No, that's really
Thank
cool.
you.
Winding down, because I know we're close approaching an hour now. I knew I had a lot of questions. I didn't mean to take up so much of your time. You kind of
Oh, no, I'm
alluded to it
having fun.
before, but I'm curious to know, in this work, how are you measuring your success in this space?
So for me, because Holistic Healing Source just launched maybe about 6.5 months ago, it's still fairly new. So I'm not expecting really to have any astronomical success within that first year because it's just about raising awareness. But my main
Yes.
measurement is really like, how many people does our content reach and what does the engagement look like? How many speaking engagements, whether it's on podcasts like your lovely podcast or whether that's at a conference or wherever, how many speaking engagements came from that? And that's like the main factors I'm looking at. But even with our library, which launched about a month ago, about exactly a month ago, has already reached, I checked it a couple days ago, it was like 23,000 people. And for that to be like done in a month was
Yeah,
like mind blowing. I was saying, "Oh, I want to reach 10K people in a month," and we reached 10K people in that first like 10 days. So like,
that's
knowing that
awesome.
people are accessing it, thank
Yeah.
you. Like, knowing people are accessing it, like, that is the main KPI for me.
What is the difference between leading with authority in your space and leading with empathy in your space? And how do you balance the two?
I would say this is something I feel like I'm getting really good at. Leading with authority, I would say, is coming from a place of, I know what I'm talking about. Look at my credentials to back this up. And then leading with empathy, I think, is more so having compassion for the people you're talking to and knowing how to tailor your content or tailor your message to something that will resonate with them. So for me, sometimes I'll call them trolls. I'll get trolls who will want to push back, like, oh, well, Dr. Calynn Lawrence, like, you have a seminary degree. Like, you studied faith based counseling. That's not the same as a psychiatrist who went to med school, or, like, stuff like that. And these are people who don't have a single degree, but they want to argue with
Yeah,
you. So then
yeah,
I'll come back with them and I'm like, this is not about my personal opinion. What I'm speaking on is proven social scientific fact. You want to read the
yeah,
studies? I have the studies. You want to see the accreditation on my research? Look at it. You want to see my board certifications? Look at them. It's not just me speaking out of nowhere off the top of my head. And that to me would be like leading with authority, but I also say it in a much more tailored professional way than I just said.
yeah.
And usually
For
once
sure,
I
for
do
sure.
that, they're usually like, oh, well, that. That makes sense then. All I saw was pastoral counseling, and I just thought you were some quack like the
Yeah.
minister I know who is like telling people not to go to therapy. And I'm like, no, yeah, you were just misinformed. But then with that
Yes.
leading with empathy piece, I think that a lot of people really enjoy how, because I have such a diverse and intersected background, I think they enjoy how I can relate to them on many fronts. And I always
Yes.
like try and find out more about the person I'm talking to before I give them advice. So there are certain things
Yes.
that are just like general good tips, but if I know certain things about you where I can specifically niche down to your situation, I try and do that.
I love that because you answered my next question. I was going to ask how, your personal tension within this space has shaped your leadership. And you said it so eloquently. You can relate to people at all fronts because you've been through it, so you know exactly how people want to be related to. I think that's huge. I have a leadership background more in corporate settings and a psychology degree, but I know that all the things, including our life experiences, all work together to be able to help us help other people. And so I love that. I love that. I think the fact that you put the time and attention and give everyone their own individual care is huge because you have to do that because everybody's different.
Thank you. Thank you. And that's also impressive with you having a psychology degree as a man of color. Love it.
Yeah, yeah, we got more work to do. I want to get you out of here on this. You kind of told me what your plans are for the future. Is there anything that you currently want to share with the people or are in need of or something that is top of mind that you want to share with the audience?
Yes. So I would say, although I have mentioned this, but please check out www.holistichealingsource.org and check out our resources. Like I say, between the library of free self help ebooks, no contact, no payment info necessary, between the courses, the presentations, we have an online directory of various different nonprofit services that may be of use to you. Please check out the holistichealingsource.org and utilize those resources that we put so much blood, sweat, tears, time, and money into producing. So
Yes.
if no matter who you are, please check it out.
For sure. And if they want to get in contact with you, are they able to?
Yes, yes. The contact info is available on the website, but you can reach me directly at ceo@holistichealingsource.org.
Love it. Love it. Thank you so much, Dr. Calynn Lawrence. We really appreciate you being here with us today. We are just amazed at what you're doing, and we hope that you continue. And any way we can support, please let us know.
Thank you so much for having me. I am so glad to have been on this podcast. You have been a true dream to interview with.
No, thank you.
Always knew I'd be here, boy, it's no surprise. Heard the truth and I heard the lies. I used to walk, but now I ride. Used to be passenger, but now I drive.